So my name's Cath Nixon, I'm a health visitor. I work in Oldham for Pennine Care. And that entails working around early intervention, prevention and health promotion. So I work with families with children under 5, and we work with families right from the antenatal period through to when the child goes to school. So I went to Nepal with VSO, which is an organisation that sends skilled professionals over to developing country to help to share skills and capacity build with local organisations. So I was based with a women's organisation there in a place called Dialek in the midwest of Nepal, working around women's health rights. So I was at an event where somebody told me that they were sending NHS staff over to Sierra Leone if I was interested in putting my name down and volunteering. And so I went away and thought about it and thought that actually yes, if I was able to help, I really wanted to. Prior to going to Sierra Leone, we'd had training, quite intensive training, which prepared us very well for the situation. But I think nothing really can prepare you for what it actually feels like when you arrive in the country. I just remember arriving and it feeling very real. Risk of Ebola feeling very real. You arrive in country and the first thing you do is wash your hands in chlorinated water and have your temperature checked before entering the airport. You really felt like what you were doing there was very important and that we have a job to be done, and that helped deal with some of the difficult times. There was obviously very difficult times, and I think like it was we were seeing what on a daily basis were quite upsetting things to see, and I think like I think being a part of such an amazing team really helped with that. I think in the time we were there, we were seeing like a decrease in mortality rates, and I think I remember one day when we had more discharges than deaths, and it was times like that, like tangible things that you could actually see the improvements that were being made, and that really helped with our work, and it helped with morale. That really did feel like we were having an impact and just in improving basic things that we could make a massive difference to mortality rates, and we were able to see people walk out of the door as survivors. So.